Hello everyone, this is Dr. Abrar Poonekar, a psychiatrist from Bangalore. I would like to have a brief talk about anxiety, depression and panic, which is very much prevalent in today's population and also the post-COVID scenario. It is very important for the common people to identify their symptoms, signs and symptoms which are associated with such disorders and take timely treatment which would help them in the long run and also end and prevent the suffering which they go through during this phase. So coming to briefly description about the anxiety symptoms, the most common symptoms which people feel are increased heart rate, tremors, sweating, giddiness, difficulty breathing, sudden loss of energy, and also fears associated like fear of falling down, fear of losing control, or fear of dying. So such things are a part of anxiety spectrum disorders. If there is the fears associated, which I have mentioned earlier, it is termed as a panic attack or a panic disorder. And also many people have performance anxiety, which is termed as to when the people are going to meet any higher authorities or going for any presentations or talks, they have the similar anxiety symptoms which I have already mentioned. Coming to depression, the main cardinal features of depression are interest or loss of the interest in previously pleasurable activities which they enjoyed before, then easy fatigability or loss of energy, and also sadness of mood, which should be present most of the times. Associated with this are the sleep disturbances, appetite, and other things which come in the spectrum of depressive disorders. So why is it important? People need to identify these things, their symptoms, and seek psychiatric counseling and help. There are two modalities of treatment in this. One is the medications, which are antidepressant medication, anti-anxiety medications, and one is the counseling, which we call as cognitive behavior therapy, in which the thoughts associated or the misinterpretations associated with these symptoms are targeted, and various therapies like exposure and response prevention and systematic desensitization are carried out. So I would encourage everyone to identify their symptoms and get treated at the earliest, which would help to reduce the socio-economic burden which is prevalent in the society, and also the post-COVID suffering which people are going through. It would be a very great initiative which the micro labs have taken to spread awareness about depression, anxiety, and such prevalent disorders which the people in day-to-day life do not identify and do not seek treatment. So I would like everyone to identify these issues and take treatment at the earliest. Together we can defeat and we can overcome mental illness, which is still a stigma in India. So let's together work towards ending this stigma. Have a happy life. Thank you. Keep calm and smile on.